From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
You get an attorney and a physician together in a television station, there's an immediate presumption that there's going to be a spirited discussion on tort reform, but that is not the case today. Instead, we are talking about what may well be the biggest chronic health problem that faces this country today, and that has to do with obesity, and how it is not necessarily being diagnosed early enough on that something can be done. Dr. Val Jones is the CEO of Better Health, and attorney Christy Ferguson is the director of the STOP Obesity Alliance. She's also an associate research professor at the School of Public Health and Health Services at George Washington University. It's great to have both of you here today.
Great to see you.
Why is it that it is such a problem in the United States for physicians who are supposed to be trained to recognize diseases are having such a hard time, what would seem to be apparent when a patient presents obviously overweight, but they're not getting, or they're not coming away with counseling or even that obesity diagnosis? Doctor, I'll start with you.
Well, we're guilty as charged. I think physicians, have an obligation to really address the overweight and obesity issue with their patients. Patients are 3 times more likely to try to lose weight if a physician tells them they need to do that, so it's really important to do that. When we just eyeball our patients to see if we think they might need some counseling, 70% of the time we miss patients who are actually obese because we're just looking at them rather than taking a look at the numbers. So there are some hard facts that we need to look at, and it's very important for us to counsel people.
Christine, how do you make that better?
Yeah, so here's a couple of things. Very specifically, I think too often we think that in order to be successful at weight loss, whether we're the person helping somebody lose weight or we're the person who needs to lose it, that you have to lose enough weight to be normal BMI or normal weight. And what we know is that a 5 to 10%, a small increment of weight loss leads to huge health benefits. So if we stop looking at this as a cosmetic thing and look at it solely from a health perspective, I think it will help docs, because sitting on both sides of that table, the patient and the doctor, they're both thinking this is an insurmountable problem. Nothing I've done in the past has worked, and why should we talk about it again? If we move the dial to something that is achievable and that we have a lot of different tools to use, it makes more sense.
We've run into the tyranny of the clock here, and I would like for us to continue this discussion if we can. Ladies, thank you so much.
Thank you.
We'll be right